I was a nurse for 26 years. I retired in 2013 and looked forward to having more time with my family. Ball games with my grandchildren, coffee with my daughters, and gardening my beautiful plants. You can take the girl out of the farm, but you never take the farm out of the girl. You know, that's when we had the big jewelry.
Big hair, big jewelry.
Big hair, big jewelry. Loved it.
Look, we're all color coordinated in this one.
Yeah, that's one of my favorites.
I remember this, yeah.
That brings up all my memories.
Everybody else is getting
6 months after my retirement, I felt shooting pains down my right leg. The surgeon said, you have a tumor wrapped around your femoral vein. Being a surgical nurse, you can't help but think about all the things that could happen. It's very frightening, very frightening. I want to see my grandkids grow up. I want to be with my daughters as much as I can. I was afraid of losing my leg and my life. I went through the surgery. I went through the radiation. I had so much faith in my oncologist, Dr. Van Tine. He said, I can't cure you, but I have sent over an intervention with a doctor that can do far more for you than I can. Oh, there's my guy.
How are you? So Karla was referred to me because pain is affecting her quality of life. Cancer pain reduces their body's chance to be at its best. Effectively treating the pain ultimately improves their quality of life. They feel strong and we can fight the cancer. I'm an interventional oncologist, which means treating cancer lesions or pain using minimally invasive procedures. We're going to get you on the scanner, belly down, numb, and go down and then put the medicine.
Okay.
Everybody knows of sciatica. Nerves like their space. So if things start encroaching, the nerves start causing pain. In 2018, we started treating a paraspinal lesion up in Karla's thoracic, and these nerves go down the back of the leg into the foot. So you can have pain anywhere along the course of that. The point of this procedure in Karla is to just reduce the pain. In interventional oncology, we work percutaneously. That means through a small entry point in the skin, and we utilize CT, fluoroscopy, MRI, or ultrasound as our imaging guidance. Here's the next one, okay? 1, 2, 3, burn. And CT guidance is super important. You don't want me sticking a needle in the nerve because that causes a lot of pain. I numb the skin, and then I go in with a very small needle right next to the nerve, and then we put a mixture of steroid and long-acting numbing medicine.
The first time I met Dr. Jennings, I had the most calm feeling. He is very reassuring, encouraging, and he gives you hope.
You doing okay, Karla?
Yeah, I'm all right.
Okay, that's it on that side, okay? With Karla, it takes 10 minutes or less.
I'll walk all day now.
Exactly.
Within minutes after I get off the scanner, I can feel the pain start to subside. My doctor said, you should have been dead 8 years ago. And I said, I know that. Thank you for what all of you have done to keep me going.
The majority of my career has been spent practicing interventional oncology, and I've been actively involved with the Society of Interventional Oncology using minimally invasive procedures like cryoablation to get local control of tumors for both cure and pain palliation. The concern I have is the patients who don't know about this treatment. These patients are unduly suffering because they failed all the other modalities of cancer treatment, and the role of Society of Interventional Oncology is to raise awareness and get this out there to the world. Patients don't know that interventional oncology can treat liver, lung, renal lesions, bone. So it's really a multidisciplinary discussion to see what makes sense and what is the best, and it's a group effort.
So this is one of my patients, CT-guided tumor ablation. You can see here that there's several needles entering the body into the center of the tumor. We're freezing the tumor. It can kill most tumor cells in the treatment zone. We took those needles out when we were done. In many instances, patients go home the same day. I found Karla's story to be quite inspiring. An interventional oncology therapy is really something that should be offered early. We see that in small kidney cancers, in small liver cancers, small lung cancers. In many cases, it can cause the tumor to shrink, sometimes killing most of the tumor cells, and in some of those instances, enabling other types of treatments like chemotherapy, immunotherapy, or surgery. The Society of Interventional Oncology wants patients to be able to ask about interventional oncology treatments as part of their care. I think access should be the standard, not the exception.
Last night, I slept so well because I did not have pain radiating down my legs. I did not have pain in my back. I did not have pain in my hip. I have gone from someone that felt like they'd just been given a death sentence to hope. I have a restored life, and I enjoy it so much.